Thanks, Jackie. To close out this session before the panel, I'd like to talk to you about one of our workforce development projects and give you a quick summary of a paper that was published last month. This is a paper about social workers. We know that social workers are a really valuable part of our AOD sector. What I'm going to do is start with somebody else's words because, again, I don't think I could have said this better myself about the importance of social workers having AOD related knowledge and skills. Because even if a social work student does not become an addiction counsellor, her or his practice will inevitably lead to interaction with clients who have addiction issues, be it in child welfare, the criminal justice system, school social work, the workplace, family counselling, or hospital social work. So it's really important that social workers have the skills to feel confident and to help clients with AOD issues. Let's think now about social workers in Australia. So last year, 46,300 people listed social work as their main occupation. And when NCETA did a survey of the AOD workforce, social worker was the third most common occupation listed amongst participants. To become a member of the Australian Association of Social Workers, applicants need to have completed an accredited Bachelor of Social Worker degree or Master of Social Work degree. So therefore, higher education providers do play a really important role in equipping social work students with the knowledge, attitudes and skills to help them support clients facing AOD-related issues. So we wanted to get some insight into the extent to which graduates might be expected to leave their program with this kind of knowledge and skills. And basically, we did a kind of drug word search through all of the accredited social work programs in Australia and tried to find which subjects were related to AOD. So we really used a whole lot of terms around addiction, substance use, different kind of substances, and really tried to do some mapping of what kinds of subjects are across all of the programs in Australia accredited by the AASW. So just to talk you through this map, there are 98 at the time of the search, there were 98 accredited programs in Australia. 63 of those met our inclusion criteria. If you look on the left-hand side of the screen, this is filtering through the bachelor programs. So we included 33 bachelor programs. We were able to identify AOD-related subjects in only 7 of those programs. So there were 9 subjects across 7 programs. 7 of those subjects were elective, 2 were mandatory. If we look at the stream on the right, this is the master's programs. We found 2 programs that had AOD subjects. There were a total of 2 subjects. Both of those subjects were electives. So really, when we look from the total of 98 programs in Australia and the subjects that are offered, AOD-related subjects are only mandatory for 2 of the Bachelor of Social Work programs. If we look a little bit at some of the content that was listed for those subjects, only 1 of those subjects was clinically relevant, and that had content around AOD assessment frameworks, pharmacotherapies, treatment plans, comorbidities, community intervention plans, and readiness to change. Of all of the other non-clinically relevant subjects, there was content on some of the mechanisms of drug absorption and tolerance, and then moving on to more socio-historical and political dimensions of AOD use, harm reduction strategies, psychosocial interventions, stages of change, intervention plans, case management, and referral. So a quick summary of what all of this might mean. I think you'll all agree with me that appears to be some fairly limited offerings, and that does raise some concerns for the preparation of social work graduates to really effectively help people with AOD issues. That's important for client outcomes. It's also important for worker satisfaction and confidence, and it's really important for reducing stigma. The major limitation of this methodology was the fact that we did focus on subject titles and a little bit of more depth, but it's possible that there were other subjects that didn't have those kinds of words in their titles that had some AOD content. It's possible that students had AOD-related placements. So our numbers might be an underestimate. However, our findings do mimic concerns overseas and concerns that have been raised for at least a decade about the AOD-related preparation of social workers. So what might we be able to do to help build these skills? Well, we know that most university curricula is full and it's hard to get extra things added. There is potential to create a micro or graduate credential that people could do in addition to their degree. But that needs to be done very carefully to not suggest that AOD is an add-on, that it's something else. And we know that AOD is really widely used and very common. So what are we doing now? We thought, let's talk to the students themselves. So we did, or the graduates themselves. So we have recently surveyed social worker graduates in Australia, and we asked them about the kinds of training and exposure and if they got placements and some of that content, and asked them about their self-rated confidence, helping people with AOD-related issues. And yeah, I will say that what I can reveal from that is that placements are associated with increased confidence, as is a designated series of lectures or content, rather than something that's just a quick dip in of information. So we look forward to presenting those findings to you at the symposium next year. Thanks for listening.